In the past, Lee Health did not recognize the robotic program as a specialty or a service line. We were just looking at the Da Vinci robot as a tool instead of an enhancement to our health system.
The robotics program, when I first came to Lee Health, was in its infancy. The Da Vinci robot was really just a single piece of equipment being used at a single campus.
Our C-suite was familiar with the technology, but at the time, we hadn't had a conversation about what a full-fledged program would really look like. My first experience with Intuitive, I would say, was rather transactional. It really wasn't a conversation about what it was that we truly wanted to build together. Our productivity wasn't where we wanted it to be. We didn't have robots at certain campuses where there was tremendous demand. We really didn't know from a data perspective where we were starting from.
One of the tools we used to help guide us in our transformation of Lee Health was the maturity model.
The maturity model helped us analyze at a programmatic view the gaps that we had and how we can engage the ecosystem that Intuitive provides in order to get from our current state to where we want it to be.
The first thing we did was put together representatives from the C-suite as well as our surgical directors to really start visioning out what is this that we really want to build. Is this simply procuring a robot, or are we attempting to be national leaders in robotic surgery?
One of the big turning points was attending 360 and hearing from their peers on what was possible.
When we went to 360, we brought the surgical directors and we also brought various surgeon champions so that we could get as much exposure as we could from as many perspectives as we could.
At the 360 conference, we made a concerted effort and sat down together and made goals.
Everyone got really excited. You could feel this energy that we hadn't had prior to the 360 conference. We were all unified in this direction and where we wanted to go.
The St. Elizabeth's visit was very positive. A lot of physicians went on that trip and really got engaged in adding to the program plan.
That allowed them to hear from a peer, essentially the same journey that they were about to embark on.
It really helped us to benchmark ourselves against an organization that does a lot of this very well, and also understanding the needs that the clinical folk have, the surgeons have, in order to make sure this is a successful program.
The Intuitive ecosystem was critical to our success. Interacting with MACA, interacting with Genesis, and also interacting with other customers.
Now they've got a dashboard with KPIs associated with things that are important for them to track.
So now we're getting into quality-based reporting, and that's leading us to optimize the care that's being delivered at a robotics level, but also across the entire system.
We are measuring efficiencies by the use of the Da Vinci, the surgeon downtime, patient experience, patient outcomes. The transparency of the data has really helped invigorate the program.
I think the data that's most important to us is the data that helps us assure our patients that we're fulfilling the promise that we've made to them.
They recognized that by following the maturity model and the path, you can quickly make advancements. And I saw that with Lee Health.
I would define our relationship with Intuitive these days as being incredibly collaborative. I feel like we are on the same team. We have the same goals. We have seen a huge uptick in robotic cases.
Together, we are constantly pursuing excellence. We want to see them continue to push the envelope and redefine what world-class looks like.
There has not been a large establishment of a robotics program here in Southwest Florida, so we have an opportunity to be the leader in that particular area.
So in the last 2 years, we've made a significant amount of advancements in every single category, from the involvement of our C-suite to development of the governance structure to our use of data and analytics. We're not at the end. We still have work to do, but we've come a long way.